On January 28, 1980, the temperature in Plymouth, Massachusetts was hovering near the freezing point. The water temperature was also cold. This is the day that Douglas Clark Thurber Jr., or Dougie as he was known to most, passed away after a fishing accident in Plymouth Harbor. Thurber was only 25 years old when he was aboard the Tur Odd with his friends when his arm became entangled in the trawl of 6 lobster pots and 2 buoys. Thurber was pulled overboard into frigid waters and dragged down almost 80 feet. A Coast Guard helicopter pulled Thurber's lifeless body from the near-freezing water. Jordan Hospital, now Beth Israel Deaconess Hospital-Plymouth, was less than 2 miles away from the rescue scene. However, the Coast Guard helicopter was forced to land 10 miles away at Plymouth Airport because there was no safe place to land at the hospital. Thurber was rushed by ambulance from the airport to the hospital, where he passed away from hypothermia. If a safe place to land at the hospital had existed, some believe that Doug Thurber's life could have been saved. The dramatic harbor rescue and having to land a helicopter at Plymouth Airport is when the idea for a helipad at then Jordan Hospital came to be. In 1981, a helipad was constructed at the hospital with a grant from the Ellison Foundation. Since then, the helipad has allowed thousands of patients to benefit from timely care when seconds and minutes matter. A memorial for Dougie Thurber was installed by his friends along the Plymouth waterfront to remember Thurber and all those who lost their life at sea. The United States Coast Guard rescued and transported Thurber to the closest airport because there was no air ambulance service at the time until a few years after the helipad was put in. During next week's episode, learn how Boston MedFlight came to be.